It seems that the amount of cells that come from the bone marrow and go to the heart is very, very small. So what we're trying to do is to give a boost for the natural process of healing of the body, giving not only more numbers, but giving at the right spot.
Soy Eddie Warman y estamos de regreso en 88.9 Noticias, información que sirve. Estoy con el doctor Guillermo Silva. Es uno de los directores del Centro de Células Madre del Texas Heart Institute. Aquí lo que se hace es estudiar las células madres adultas, la función del tratamiento para poderlas enfocar a enfermedades cardíacas y al sistema circulatorio. ¿Qué quiere decir eso? Que con las células madres hoy se puede recuperar el corazón y funcionalidad del sistema cardiovascular. Están investigando con aportaciones que los pacientes o cuando los pacientes tienen una insuficiencia cardíaca o un infarto al miocardio, por ejemplo, cómo poder recuperar esa parte muscular o ese funcionamiento del corazón. Las células madres tienen esa magnífica capacidad de convertirse en muchas cosas, en muchas células dentro del cuerpo. Así que me han hecho favor en este centro médico de abrirme las puertas, de invitarme a platicar con el doctor Silva. Y doctor, pues muchas gracias por recibirnos. What means working with stem cells? Let's go to basic and try to understand for the people who's listening to us or watching the web TV, what is stem cells, where it's coming from, and what's the idea of Texas Heart Institute to work with these stem cells in favor of what?
Okay, we're all products of two stem cells, right? One coming from your mother and the other one coming from your father. They meet together and they turn into an embryo. That will actually develop into a whole body, into a person. So basically, the stem cells are the building blocks of your body. And we've known for a long time that stem cells live inside the bone marrow, live inside the big breastbone here that you have, or inside the hip bones. Those stem cells, they actually renew all your blood cells, And what we found over the years, over the past 10, 15 years, is that those cells not only can recuperate your blood cells, but also can regenerate some of your heart cells. This effect is not completely successful after a heart attack. So what we're trying to do here at the Heart Institute is to substitute and improve heart muscle by increasing the amount of blood flow, that heart muscle that's suffering from chronic lack of blood flow gets through injection of stem cells coming from the bone marrow. We believe that this takes at least about a month and a half for them to start working. All the patients that improve on average after a month and a half to 2 months. And what the patients feel is that they usually can do more. Before they couldn't climb 2 flights of stairs, and now they can. And there are some studies in animals that actually have shown that the deposit of plaque inside the aorta of a mouse can be reverted by injecting stem cells.
How does heart looks before or after a heart attack, or before a stem cell injection, and how is the procedure to make that heart right again?
You can focus here; it's probably better so that you can see this. Here is a patient that received stem cell injection. Here in the top, I'm pointing here, is an area. All this here in red means that the heart is practically dead, this area.
All the red?
All the red in this top picture here.
How do you call this kind of picture?
This is called the NOGA map. It's called an electromechanical map. So what we do is we go inside the heart with a catheter that looks like a little piece of a plastic that we touch the inside the heart many times, and we create this shell that looks at the health of the heart. And we see here that the only healthy part here is this purple part here. And all of this has taken what we call taken a hit, meaning different levels of heart attack The bottom map here shows that all of this heart is red in terms of function, in terms of the squeeze of the heart. So what we're looking here as is an area, is an island of heart that's still alive, but it's not moving.
That's a green?
This green here is an area of heart that's still alive, but the bottom map is the map of movement.
Okay.
So it's not moving, but it's still relatively alive. There's potential here for coming back. And you can see here that 4 months after we did a follow-up map, actually this map was done by Dr. Perrin, you see that what I call here an island of goodness that went from red to purple. So the stem cells that were injected right here, the black dots are the stem cell injections, have actually revived, renewed, or awakened.
And my question is, if it could happen the way you're saying, it means that all heart will be revived?
That's the ultimate goal, is to revive the whole heart, but we're not there yet. We know that we can probably revive pieces of the heart. And the more the heart is alive, the more we can revive, and the biggest the effect is in the heart. Actually, it's a great time to be a mouse nowadays, because you can actually recreate the whole heart of a mouse.
How far, how close, how real is that?
We're not close in humans. No, we're not. Not all the patients get better, but we're seeing that this holds a big promise for patients, for a lot of patients that are suffering daily without oxygen and can't breathe.
If somebody from Mexico wants to
Come
to get some of this treatment, to be in these protocols, just arrive or just call to the international
department. Absolutely, yeah. Call the international department. They need to be willing to come and travel a few times after the cells are injected. But we have patients from Iran, for example, from Canada, that come and fulfill their follow-ups here. I don't see why patients from Mexico, which is much easier to come to the States, cannot have this done here. No, absolutely, they can. They should call if they're needing help, absolutely.